Good morning. We're at Circuit World this morning with Ask the Doc while BKP's on his device over there, and he's just got through telling you about the disaster in the voting boxes down in Atlanta and Gwinnett County. But we're here to have some good news about what's good about the COVID virus, and we're not going to sit here and talk about politics. Dr. Ray
That's
Tidman,
a pretty good opening.
Dr. Ray Tidman is my guest this morning, and I'm not wearing my veteran's tie. Veterans Day is coming up. It's a beautiful sunny day in Blue Ridge, about 40 degrees. And BKP, are you going to take over now?
Well, you know, if you're going to do the weather, we would like to know what the crosswinds are.
We're 21.
Right, I mean, we don't want the temperature without precipitation.
Okay, we're 21 inches up in rain still. The lake has got is about 7 feet below maximum pool, but the boats are all out of the water.
Folks, thank you very much. We are at Circuit World in Blue Ridge. We want to thank Georgia Cancer Research Center, affiliated with Northside Hospital, for this segment. Again, Dr. Raymond Tidman and Dr. William Whaley, I appreciate you guys. I know you guys powered through. You did a great job last week. I got a couple messages, so I appreciate, and our viewers appreciate you. I just want to say at the start out, they appreciate you continuing to update us on where we are at, or some of the things. Yes, one of our viewers have sent us some hats that we gave the doctor. We have for the All-Star Political Panel. We appreciate each and every one. Yeah, powering through the news of the day as far as elections, we still have a pandemic out there. This week, they're saying, and you know, you say you want to stick to the good news. Now, where the media is concerned, I'm not hearing any. When I say any, I know that's a big word, but I'm not. I'm hearing Europe is on lockdown. Germany's locking down. Johnson's locking down Great Britain for a month or something.
Well, they locked down New York. To go to New York as of Wednesday, you have to have a negative COVID virus test within the 4 days and have it in your hand, or quarantine for 2 weeks. Even now, this unless you come from New Jersey or Pennsylvania. And after you've entered the state with a negative COVID virus test, 4 days later you're supposed to get another test that says you're negative, or quarantine. And that is about the worst shutdown I've heard anywhere, anytime. And Europe has got some that are just about like that. I think what the good news is that yes, there's 1,000 cases, 100,000 cases a day. The case rate, which I wanted to get into the rapid test versus the long test, but the death rate in Europe per 100,000 people exceeds the death rate in the United States per 100,000 people, and Georgia's at the bottom of the death rate. I mean, that's the good news. I mean, yeah, there's a virus out there. The big thing yesterday, everybody, 8th grader in Missouri dies from the COVID-19. 8th grader Peyton Baumgarth died this weekend after having symptoms, according to officials from Washington's Middle School in Missouri. This virus is going to kill some kids that are young. It's going to kill one, and it's going to be international news. It's still a disease of old people. There's a study that came out yesterday that I think shed some light on what we need to be doing and worrying about. This was Great Britain, British Medical Journal. You trust them. They took 20,000 cases in the first parts of the epidemic. Now, that's where everything's worse. They're going to say things will be better. And the fatality rate among cases in the first several months of the epidemic was 1.15% of all cases in countries with high income. Now, Emily, was the death rate in poor countries higher or lower? Actually, much lower. The death rate in low countries was 0.23%. Why? because high-income countries have a long life expectancy, a high population of the elderly, and they don't die in their 40s of infectious disease. It was another way of saying that this is a disease of the elderly. In the first wave, the death rate in people under the age of 40 was less than 0.1%. Well, we know it's much less than that now, but then the first wave, but over age 80 was 5%. 50 to 55 was 1 in 250. So one more time, this is a disease of the elderly, even if the first thing on the news was the 8th grader from Missouri.
So let me expand on that, because I think that's really the thing we need to bring home. Because I get, one of my pet peeves now is this case rate, this case number, this overall number.
Got it right here.
So this disease affects different ages differently, and it runs through populations based upon their intensity of housing, how tight they are versus how spread out they are. Not only that, but what we test with today is different and evolving technology than what we tested with at the beginning. So there are more tests on more different machines being affected in more different ways. So Bill just flashed for me, the big numbers, the big scary numbers, okay?
I don't think they're scary. I'm getting ready to put them up here.
But the thing is that it would be completely irresponsible for a mathematician to put cases on the same graph, okay?
Well, let me not interrupt you there. I know what he's saying, and I'm hearing you when you say not scary, but I know what you're saying because I watch on a daily basis. And for example, yesterday, the media outlets were running the 100,000 cases a day now. We're up to the 100. And when you say the big scary number, that's the numbers they're trying to scare us.
Well, they keep adding things on.
Right.
Okay? But to take this for example, when we started the epidemic, we didn't have enough machines, and we were only testing people that had symptoms.
Right.
Okay? You jump forward to now, we're testing football players every day, we're testing college kids 3 times a week, and we're testing high school kids and elementary kids ever more. Okay? That's a totally different population than older sick people that we're presenting. So they're different numbers. I mean, if you are a scientist and you're measuring water in a beaker and you're measuring water out in a pond, those are 2 different places. Okay? You may be using the same thermometer, but they're 2 different areas that you're testing. So to put it all together as though it's one thing is nonsense.
And look at this now, BKP. For the first time, everybody's been complaining about Georgia not reporting. This is the first day they've reported antigen positive cases versus with PCR cases. So yesterday, they said they had 24,882 PCR tests reported yesterday. 1,800 of them were positive. That's 7.5%. But up there they throw in, you got another 500 that were the antigen tests. Now that's the one we're talking about. They go to the the football players every day. Part of the United States is calling antigen positive tests a case. Georgia doesn't. Georgia lists them up there, how many tests we had. But when you get down to the cases, they only are using PCR positive tests. And I think when the nation starts talking about 100,000 positive cases, they are adding all of these PCR cases to the number. Whatever the number is, it's a big number and it's growing. When we were looking at this thing here for total deaths in Georgia a week and a half ago, the total deaths were 6,000. It's 8,000 now. I mean, that's a number. It's gone up a couple thousand in, 3 or 4 weeks. So it's not that this is not a serious epidemic. It's not that the numbers are going up. But once again, this 9-year-old kid, or eighth grader, he would have been 8th grade is going to be 11 or 12-year-old kid, is 1. It's still 5% fatal or greater if you're over age 80. That's the number.
That's the group.
That's the group. And so when New York State shuts down and tells you to get a negative test, and you're a 15-year-old kid in college coming back to college up there, to me that's ludicrous.
It's nonsense.
It's nonsense. And you can't shut down half of a country. And the shutdowns in Europe aren't really working. You know, France is putting more people at the border to stop certain ethnic groups from coming in and cutting people's heads off, and they're not checking for a negative COVID test at the border. Yeah, I mean,
It's just chaos.
it's just chaos. Yeah.
Let me expand on the not part of that. Brian, how much money did we allocate as a country for COVID so far? Is it over $3 trillion?
Yeah, that's what I was getting ready to say. I hope that's not a trick question, because I think it's in the trillions.
It's
here.
$3 trillion.
It's like $3 trillion.
Yes, it's
Okay.
yes.
So approximately there's 60 counties in each state. There's 50 states. So there's about 300
No,
counties.
there's 159 counties in Georgia and Texas. You were off on your county number. I wasn't going to argue with you, but there's 159 counties in Georgia, and there's 100 and something in
Check me
Texas.
on that real quick.
What?
How many counties in the United States? Maybe
Oh,
Georgia's got a lot of counties.
Does
No, Georgia
159
does, but I think what you're doing is an average.
it's good. It's an order of magnitude. So go ahead. We're not going to argue with
okay,
you.
we'll throw it out there. Let's say there's 3,000 counties.
Yeah.
I think there's 300, but let's say there's 3,000. 3 trillion divided by 3,000 is $1 billion. $1 billion. Get the number there. $1 billion per county.
Right.
Of debt.
Now, what if you put no, I'm talking about debt. Yeah, new debt.
Yeah,
new,
because
just on COVID.
Fannin County can't hardly come up with 17
Imagine
million
headlines
for a
in
budget.
Fannin County. Hey, we've been allocated $1 billion of new debt. Where are we going to come up with this money? We don't have a lot of billionaires living
Did you
here.
find out how many counties?
3,140.
Okay, so I'm
Okay,
off a
I told
digit. Okay, so $1 billion per county. If you just want to try to get your head around these big, nobody knows what $1 trillion is. It's hard to know what $1 billion is, but we know $1 billion is a lot of money. So where are we as a county going? If we had to come up with our $1 billion, where are we going to get that? And then you put us all back into the houses, and you can't work, and you can't take care of yourselves, and maybe you're going to go hungry this winter. Too bad, because we got this virus out there that has numbers that we can now approach, and we have treatments that we can use on it. We got a vaccine almost coming out. Oh, let's shut down all over again, and let's put another $1 billion per county. It's absolutely ludicrous. So that's why we keep emphasizing on this program. You got to do the smart thing. You got to try to protect people that are at risk, and everybody else needs to get to work and get back with their lives and take care of yourselves, because you do have to eat in the wintertime.
Well, I want to say this, and I always want to be. I want to say out there, because people watch, and we have a platform here, and we have a megaphone. So regardless if it's 10 people or 10,000, what we say, we have to realize that somebody listens to. So I have always supported both of you in this program, as far as from day one. Treat our seniors as fine china. Don't take the risk with our seniors and the vulnerable groups. Now, I'm not telling you to take the chances. Everybody, individually, you take your own chances you feel. If you have health issues, we know enough now. As Americans, we know enough now, with not just this program, there's some other good information, that we should be able to determine, I'm a diabetic, I'm overweight, I have asthma, COPD.
I'm 80 years old.
What my age, right, whatever, okay? We should be able to have the self-responsibility of, I'm the one that really needs the mask.
Not only should, we do.
We do, okay, but what I'm saying is, leave that up to the individual. It's time we have enough information. I have taken, and I don't say this, and that's where I'm going with this, I know long-winded, I've taken every chance you could take. I mean, even from last week, not going into detail, I had a brief hospitalization, which I'm fine, I'm absolutely fine. But I've gone from being in hospitalization to 3 weeks ago being at a rally that had 15,000 people. I mean, I've taken every risk out there And, you
But
know,
Brian, we all do that all the time. I mean, when you're going to Atlanta and you push a little bit harder on that gas pedal, you go 70 instead of 65, you're adding to your
that's
risk.
what I was just getting.
We are adults. We have our own agency. We make our own decisions. This program is to try to help people understand the risk of COVID and how you mitigate that, how you reduce it. But we keep saying for other people to step in and take away your agency and say, well, you're too dumb to understand this. You need to do this, this, and this. That's wrong. And it's not only is it wrong medically, not only are you harming people medically because you're delaying their cancer diagnosis and not getting their diabetes treated and their hypertension treated, not only is it wrong medically, but economically it's a disaster. And it's increasing poverty. So every time we see these headlines in the media saying, oh, we got to lock down again, or look at Europe, Europe's locking down. Well, stupid is as stupid does. Okay? Well, why do we have to keep doing stupid? It's stupid. Locking down is stupid. It's been gone over so many years.
So what you're saying, and you take it over here, but what you're saying is, if you're out there this morning and you're sitting there and you're hearing the networks, Europe's locking down, Germany's locking down. Okay, that's over there. That's not here. Let's not go ahead.
And New York. Okay, now, so let's say lockdown, and how effective would a lockdown be? There's been information that has been published that if you take a vitamin D supplement, it can lower your chances of contracting the COVID virus and can perhaps make it less severe. Now, take a vitamin D supplement. That's not locking you down. Reported yesterday that this is a great study. I've always said flu shots. My wife says no flu shots. Okay, here's the story. Published yesterday. If you take 2,000 COVID cases and see who has had flu shots and who has not had flu shots, the people that had flu shots, had not had flu shots, have a 2.4% times greater risk of going in the hospital. That's 240% higher risk of going in the hospital, and a 330% higher risk of going to the intensive care unit. That's the people that did not have flu shots. Now, we got people say, oh, flu vaccine, it's made in Europe, it's got some. I mean, if something was going to give me a 300% less chance of going in the ICU, I would take my flu shot. So now, here you got vitamin D, you got a flu shot, you've got a mask, you've got 6 feet. That's the mitigating things that we ought to be doing better than going into New York State with a negative COVID test. But you know, New York was clever there, because we've said negative COVID test doesn't tell you you're not going to be positive this afternoon, right? So now they say you got to have another test 4 days later. So they're eliminating that part that you might have had a negative test and be incubating the virus by doing it. How many people you think going to New York State are going to voluntarily do that? I mentioned that thing in France just because they don't have anybody at the border in New York State when you drive in with Georgia tags and you go through the tunnel asking you for your doggone certificate. I mean, as
you were talking about that, I was just thinking to myself, I have crossed the GW, George Washington, many times.
Hundreds of times.
I have gone through the Holland and Lincoln
Hundreds
Tunnel.
of times.
And I was just stopping to think about those people that take the tolls, what it must be like to check your papers. We grow up.
They're not toll takers anymore. It's all done, and there's no toll takers anymore. It's all done either
electronically,
off Easy Pass, or if you don't have Easy Pass, it sends a bill to your But
I just stop and think, what it's got to be like to have somebody checking to make sure
you
have your proper documentation. There's a couple things I want to make sure of, because before we leave, obviously we're not talking about the election in this segment, but the election has played a part in the rhetoric, the how things have been reported.
Information.
I will say weaponizing information. It's played a part. So now we are doing our first COVID update after post-election day. We're still on track for a rapid, on track for a vaccine.
Yes.
That's still on track, right?
I'm still saying January, February.
Right.
But yes, we are on track for it.
And for those out there that are, if you're new, if my memory serves me right, you said one of the most rapid vaccines we ever developed was the mumps in 4 years.
Yeah, it took 4 years.
Took 4 years to do.
Okay,
get
all
the
right.
mumps, right?
Let's go back to the news just a minute.
Okay, go
All
ahead.
right, so because it's I always want to stay ahead of the mass media. Study was just done and reported this last week that again took people in the first wave. See, you can't. I mean, how long does the antibody last in your blood? We've said this all, probably less than 3 to 6 months. The epidemic's long enough now to know that that's true. Well, people that were in the first wave, though, their T cell immunity, which you remember we were the first ones to talk about T cells, been 6 or 8 weeks ago. That T cell immunity has not deteriorated by a whit from the outset. So the antibodies have gone down, the T cell immunity is staying up. Now that may be one of the reasons that a flu shot helps prevent you from getting worse COVID, because the flu shot cranks up your T
Stimulates your immune
cells,
system,
cranks up your T cells. So we only know that the T cell stays active for 6 months. Well, why do we know that? Because the epidemic's only that long in terms of having the data. That thing might be there. Measles vaccine lasts for a lifetime, doesn't it?
Yeah.
Smallpox lasts for a lifetime, doesn't it? So we have been discouraged about the fact that a vaccine is really going to work if you're depending on antibody immunity, because we've proven the antibodies don't last long. But we should be encouraged that it's going to work if it's going to be one that stimulates T cell immunity. Well, the two that are looking to be on the shelf by December, which means it'll be January, February before it's out here at Ingalls. Both of them have T cell stimulation. So to me, that's a very encouraging sign about the vaccine.
What about, should rapid test positive be called cases?
That's what I put up here earlier. That's
Right.
exactly. Georgia did not. If you'll notice, Georgia
Right.
left a rapid separate from the cases. In many states, they are calling them cases.
Right.
So you've got apples and oranges, and that's why I say, I think it was Ray. If it wasn't Ray, it might have been Dr. Rearick said there are 50 states 50 countries in the United States, because there's 50 different states. You're looking at that with the election round, right? Every state has the right to say what a valid ballot is and how you vote and all that sort of stuff. So they're mixed in the way they did things. They're mixed in the way they're reporting this data by state. So that states like New York and New Jersey and Pennsylvania, those New York states are all calling a antigen test a case.
And I think what you've said in the past is not everybody that tests positive is sick.
Right.
And particularly the antigen cases. I mean, that's a bunch of school kids. We're not doing antigen tests at the hospital before your colonoscopy, for example. They're not reliable. If you're going to go get a colonoscopy, you're going to have a PCR test. It's going to take 48 hours to get the report. If you're going to do an antigen test, you're going to have a result in 15 minutes, and yes, you can play in the game. So it's for a different purpose. Everybody knows it's got a bunch of false negatives, but we're not worried about it if all we're doing is taking the kid and put him on the field to play a game, or letting him in the school, or letting him in a concert. Use it in those regards. Yeah, use it to screen people for a concert. Use it to screen people for their athletic events. And when Saban tested positive by a rapid test, and everybody said, okay, Saban can't play, they had a protocol in place, didn't they? That protocol was do 3 PCR tests 3 days in a row, and if those 3 PCR tests are negative, he's negative. Well, he tested positive on the rapid, negative on the 3 PCR tests that he coached. That's the way to use that. That's the way to use that test. It's not a case test.
I'm trying to get my head around the angst that I think Bill and I are expressing, and it's
Me, angst?
well, I see, we were talking about the elections, we were talking about the testing, and many other things, but I think it comes down to that we are a country of very diverse cultures and geography, and to have a group of small people, small-minded, if I might say, who think that the way they see things is the way the country is, and that they don't allow for all this diversity is a rub. It's a major rub. We've talked about our local situation of the mask, get your vaccine done, stay away from people that you fear and that might have the virus, get in early, stay healthy. Those are all important things. If we were in New York, I'd be saying, well, don't get on an elevator with 20 people and don't be riding those subways. Okay? Now, having them stop cars or ask for people that are coming into the state of New York is a distraction. It's a freaking distraction. They ought to be focusing on the real tight urban areas where this thing all started, because you had dead air and you were pushing all people into that same dead air, and all it took was one person to see.
Well, New York
20.
State's dead as a doornail. There's not an elevator with one person in it, much less 20.
And so economically, it's going to get hammered.
It is happening.
Well, interesting you say that, because I, remember not long ago when you went to New York City or anywhere and you had an elevator situation, you would have people say, come on, there's still room.
Yeah.
It's like, and you were like this, and the doors would close, and
Your nose was up.
Subway
right,
too.
and same thing with the subway, right? Come on in, there's still room. And I tell you, I do this when I don't go to any crowded office buildings, but when I go to somewhere and there's an elevator and there's somebody that gets in, I actually say to them out of respect, do you mind if I ride this, or I'll wait till the next? If they don't want me in the elevator with them,
You're
I won't
wearing
get
your
it.
mask,
Right.
though.
Yeah, but I'll say to them, hey, you mind me? Because I made a mistake. I was at a hotel here not long ago, and I was on the second floor, and the door opened, and there was a family in there, and I got in the elevator and went down. And they looked at me like, I can't tell you how they looked at me like.
Because there were already 4 people in the elevator.
Yes, and then when we got out, I looked at my wife and I said, did you see that? And she said, yeah, but you didn't see the sign that said only one family at a time. And she said, you jumped right in the elevator.
Yeah.
I'm
Well,
sorry.
the other thing is, all the elevators that I have been in, I've been in a bunch of them the last few weeks, because one day a week I have to go to Atlanta. Not the elevator in my apartment, I'm not talking about it. But there's a circle on each of the 4 corners. And then in the middle, it says, please respect our 6 foot, and then it's got arrows
Right.
pointing to the 4 corners. And nobody that has been in our building at Northside Hospital, to my knowledge, and I was in the hospital last week in 2 different professional buildings, has been on an elevator with more than 2 other people. So there's always an empty spot in those 4 corners. And then in one elevator, Jane was questioning, I don't think this is actually 6 feet apart. So I asked the guy at the maintenance man there, he says actually 6 feet 2 inches. So I haven't been in any elevator that the corners weren't 6 feet apart from one another, and they are respecting the elevator space.
Let me close with this morning, and then, whatever you want to, that you may want to wrap up with. Because I don't know when we have a new viewer, it seems like this is not being redundant and going over it. How concerned are you this morning in America that the focus we put on COVID, not that it's not important, the health of America across the board?
I think America's pretty healthy physically. I think mentally we're really beat down, and I think economically it's getting scary for a lot of folks, and those are major weights on the health of the public.
But my question, I guess, getting more direct is, I've heard people talk about seniors that are going through depression.
Oh, yes.
Oh, it's awful.
And suicide rates and things like that.
Drug use in kids and alcoholism and family destruction. I mean, that's the hard thing. That one of my real hopes with this election was we get through it, get open, and move on ahead. Now it looks like we're going to be in the courts in December and arguing about this for 2 more months. The whole argument's unhealthy, and then maybe they'll back off on beating the drum on COVID about run away with and hide, but it's still going to be a morass, and we've got to get back to a life.
All right, let's go over here I'm gonna go over here on the good side. I think people should be responsible for their own health. I've got 2 groups of patients that are 180 degrees apart. Those that have gone into this COVID thing and have gained weight and sat around their house or their apartment and are depressed, and those that are working from home and have started vigorously exercising, going outdoors, running and walking, following a good diet, doing push-ups and stuff, and come in and look like they just got out of boot camp. That's up here. I believe a Christian makes the choice to believe. It's a voluntary choice to believe in Christ. It is a voluntary choice that you decide to have the discipline to get up in the morning, pouring down rain, you got a toenail that's ingrown, and you show up at work 10 minutes early and you give them a good day's work. And that's a difference about personality. That's why I love Marines. I think people are responsible for their own way of dealing with this virus, and that they need to look at themselves and say, I'm being a wimp. I need to get on with my life. If I'm going to work from home, I'm going to get up early and I'm going to eat yogurt instead of donuts, and I'm going to go out and walk for an hour. I mean, take a positive attitude. This glass is half full, not half empty. Things are coming along that are going to help us. The vaccine's out there. We know that the T-cell thing works. Go get the flu shot. It might help you COVID virus. And don't argue with me about it being a plot. Take your vitamin D. I mean, there are lots of reasons to take it, but do these things that can protect you from the COVID virus and can protect your health while we're fighting the COVID virus. Just sitting at home and drinking and eating donuts and sucking your thumb has got to quit. Get out of the house.
I don't suck my thumb. And I don't drink the donut, but I do the donuts.
Let me feather that just a little bit, because I think that's excellent advice. My experience is if you ask somebody to throw that big of a switch all at one time, they're kind of setting themselves up for failure. So take his advice, break it down into its parts, and start doing parts of it, and keep adding it on, build up to it. Okay, don't trick yourself and say I'm going to go start lifting weights and running 5 miles a day, and tomorrow
and stop eating donuts.
Yeah. You know, you've got to incrementally add things, but if you're committed to it, and you figure out how to measure it so that you can give yourself the pats on the back. Hey, I did this many miles this week, or I ate this many
steps on my watch.
My problem is plurals. Donuts is plural.
Yeah,
that's been my problem. Not a donut.
That's just for when you go off the rails.
Right.
All right.
Hey, let me say this.
One more time. I think the flu shot. There's evidence, hard evidence this week that the flu shot may help you with not from getting the COVID virus, but help you not get hospitalized or in the ICU.
Let me say this. Please excuse the bad language, and I don't mean it like it's like, but it's like last night I was looking at something and as far as a meal, and I said, when I eat this, I'm going to have heartburn. As I was looking, I'm going to have heartburn when I eat this. Well, it's my own damn fault, okay? Because this morning I'm looking for something to take care of my heartburn.
Oh, those are Tums sitting there.
Yeah.
Huh?
But I looked at it, I analyzed it, I came to terms it would be heartburn. There's such thing in the world, I say this not ugly, but there's a such thing where it's our own damn fault, and we have to have control. My plurals are a problem. And anything else? Final.
No, I think I've done it. I'm really leaning on taking vitamin D and flu shots.
I wanted you to know that Leo offered to stand in for you anytime that you need to take a day off. So
Yes, I know. I heard Leo would come and stand in at any time. I love Leo's great. We're going to take a break. Thank you, Ask the Doc, Dr. William Whaley, and Dr. Raymond Tidman every week for this great information. Thank you, North Georgia Cancer Research, affiliated with Northside Hospital. We are going to take a brief break, and we're going to come back, and it's time for our all-star political panel. And I know they have a lot to say about Georgia, nationally, election, a little bit of everything. So we'll be right back.
And there's going to be a guest.
Yes.